But the gold standard in terms of tooth isolation is the rubber dam isolation, and this is advocated in the literature as the best form of tooth isolation. And when I start to show you some pictures of this, you will understand why. It is something that is supported for endodontic or root canal treatment. Most societies of specialists endodontics will suggest in their policies and clinical guidelines that rubber dam isolation is mandatory for that type of treatment. We recommend it for restorative procedures as well as endodontic treatment, but particularly for dental materials that are sensitive to moisture or hydrophobic, such as resin composites. They're extremely sensitive to moisture, and so most of the companies who produce those materials will suggest very strongly to the users of those materials that rubber dam is used routinely, otherwise they won't guarantee the success of those materials. So with rubber dam there is some equipment that you require in order to place this onto a patient's tooth. Some of the equipment is sitting here. This is actually a restorative tray, but it contains instruments like flat plastic instruments that are useful for applying rubber dam. You can see here the green rubber material, that's the rubber dam itself. There's a little device here called the clamp, which we'll look at more closely in a moment, and it's the clamp that sits on the tooth that holds the rubber dam in place. On this side of the screen you can see from the top the rubber dam punch. So that device is used to place holes in the rubber dam itself so that the teeth can actually stick through the hole, and they're secured in place by the clamp. This device here is called the rubber dam forceps, and they are designed to carry the clamp over to the tooth, place it on the tooth, and once it's securely on the tooth, the forceps are removed. And then there is the rubber dam frame, and that's used to hold the rubber dam out flat once it's placed, so that you have a nice open field with visibility. So let's look at each of these things in turn. The rubber dam is usually made of a latex material, although more recently with the concerns with latex allergies, it is available in vinyl format as well. The vinyl is a little more expensive, and routinely most dental practices will use latex, but of course we'll ask the question of patients about latex allergy and use alternatives if that's a problem. The rubber dam can come in various forms. This is a roll of rubber dam, and you'll have to cut pieces to the length that you desire for the procedure. There's also pre-cut squares of rubber dam. This is what we'll be using in the simulation laboratory. It's already cut to the appropriate size for you. So these are sort of flat sheets of latex. There's also some new devices on the market where a latex or a vinyl a molded format is made, and you can see here that they are sort of molded to fit the inside of the mouth, and they come with their own frame system. This system here, some people prefer, it's more comfortable, but of course it's much more expensive than this one here. Routinely this is the one we will generally tend to favour. Rubber dam needs to be looked after, so you can't keep it in the cupboard for 25 years. Like any rubber product, it will deteriorate over time, so don't overstock, and make sure that you rotate the rubber dam through your stock cupboard. It needs to be, like other rubber products, kept in a cool and dry environment, otherwise it will deteriorate. Rubber dam also comes in varying thicknesses, so depending on your preference as an operator, whether you want a very thick and durable rubber dam, or whether you are happier manipulating a thinner, a more friable thickness. That's sort of personal preference. Usually for beginners we start with a medium thickness because it does tend to tear if it's used inappropriately. Generally the rubber dam will come with two sides. One will be a sort of matte side, and the other side will be a shiny sort of reflective side. The matte side is sort of powdered, and that's generally the one we will face up towards the operator. You don't have to, but that's my preference, and that's the recommendation as well, because the non-matte side, the shiny side, will tend to reflect the overhead light back at you, and that can be unhelpful in terms of glare, but it also has some implications for looking at the colour and contrast of the tooth as well. And if you're using tooth coloured materials to restore, you really want to get a good sense of the natural colour of the tooth without all of that light reflecting around it. So I use the matte side facing up. There's all sorts of ways to use rubber dam. This is not one of them. The next important piece of equipment is the rubber dam clamp. And the rubber dam clamp, as the name suggests, clamps the tooth. So the rubber dam is held in place with this metal clamp. And if you're isolating a number of teeth, so if there are 3 or 4 teeth in a row that are poking through the rubber dam, you will have the posterior tooth, or the most back tooth, will be anchored, the dam will be anchored with the rubber dam clamp. And then there'll be an anterior anchor towards the front of the mouth, which may be a rubber dam clamp, but is usually a wedge or something else, which I'll show you in a moment. So in terms of the clamps, there are multiple types of clamps. There are different clamps for different sized teeth. So as you are aware now, some teeth are larger than others, some are round, some have a more rectangular or square shape, and so we need different shaped clamps to fit those teeth well. You will learn over time the different numbers and types of clamps, the different shapes, and you'll be able to make judgments about which one to use for particular teeth. We'll provide you with guidance at the beginning, but there's no one rule, that the 1/6 always fits molars, for example, or the 2/6 always fits premolars. It depends on the size of the tooth as much as anything else. But in terms of the basic components or shapes of the clamp, the thing to note are that there are these two elements here called the jaws. The two jaws are joined by this bow, and here located at the junction of the jaw and the bow are 2 holes, and these holes are important because this is where those rubber dam forceps that I talked about previously are going to engage with the clamp, so that it engages and locks onto the clamp so that you can carry with the forceps the clamp across to the tooth, place it safely, and then remove the forceps. Okay, so just memorize the names of the parts of the clamp, because we'll be talking about it when we're looking at placement of the clamps. And there are multiple clamps, as I said. These clamps are designed exclusively for front teeth or anterior teeth. We have a number of clamps here which are designed for the premolar teeth, and you can see that the size of the jaw for the premolar teeth is different from the size of the jaw, for example, for the molar teeth. The jaws are much broader for the molar teeth and much shorter and rounder for the premolar teeth. And if you think about the shape of the teeth, you can understand why that is. The rubber dam clamps can also come as bland or retentive. And as the name suggests, retentive means that they will have what we call teeth. They will have design elements built into them that mean that they retain or grip the tooth more effectively, as opposed to the bland, which just sit in place and rely on the convex nature of the tooth to stay in place. And again, it depends on the tooth that you're clamping and how far it is erupted into the mouth, whether you select retentive or bland. But again, we'll learn that over time. And there's also winged and wingless clamps, and the meaning of that is not really important at the moment, but we will talk about that later. Just be aware that there are many different kinds of clamps, and each clamp is designed for a different purpose and potentially for a different tooth. Now, when we're using the clamps in the mouth, it's very important that we secure the clamp with some floss, because as you can see here in this radiograph of a person's abdomen, this clamp has been lost into the mouth as it was being placed by the dental practitioner. Unfortunately, the patient, rather than spitting the clamp out, has inhaled the clamp, and so it's lodged in the patient's lung, which we can see on this radiograph here, and had to be surgically removed. Now, that's not a good look when a patient comes in to have a fissure sealant and ends up having abdominal surgery as a result. So it's very important that we reduce this risk and that we use something to secure the clamp so that if it does fall off the forceps as we're placing it, or fall off the tooth after we've placed it, that we have something to retrieve the clamp from the mouth. So the floss is secured to the clamp prior to placement on the tooth. And it can be done in a number of ways. This is one way that I prefer, and this is another simpler way, and we'll talk about that also in a little more detail. Unfortunately for this patient, they inhaled it. Sometimes, if they're lucky, the patient will swallow it, and then of course a couple of days later they will return it to you. But if it does become lodged in the lungs, it's extremely serious. So it's very important to think about securing the clamp prior to trying it on the tooth. The rubber dam punch is this device here. This is a quite expensive piece of equipment, so please look after that. But it's used to punch small holes into the sheet of rubber dam, which then allow the teeth to be pushed through them. The rubber dam punch has a wheel with multiple sized punch holes. So depending on the size of the tooth you're clamping, you would turn or rotate the wheel to the appropriate size hole, and then place the dam between the wheel and the punch here, and click to punch the holes. Now, for a single tooth isolation, you would of course have one hole in the dam. If you're isolating multiple teeth, then you will need to punch a number of holes, and each of those holes may be a different size. Now, the dam, when we are punching it, we need to think about where the teeth are going to sit in relation to the sheet of rubber dam, because what we effectively want is the rubber dam to be covering the entire mouth, okay? So that we're isolating the mouth from the operating field. So if you think about the dam in this way, this line in the middle of the dam should correspond to the midline of the patient's face. So the midline should be sitting in the middle of the patient's face, half of the dam on the right hand side, half of the dam on the left hand side. And the other thing you have to remember also is that the dam needs to be sitting in this dimension, this half here, aligned with the occlusal plane. So you don't want the dam sitting too far up here or too far down here, because we want to position it directly over the mouth. So that has consequences for where you place the holes. So this diagram actually shows you, looking at the dam on the table, this is where we would punch the holes for each of the teeth, depending on whether we're isolating the upper teeth or the maxillary teeth, or the lower teeth, would be punching in relation to where these teeth are on the dam. So in your mind, divide the dam up into sextants and then determine where the tooth is in the arch in relation to those sextants and punch the hole on that part of the dam. Once you've done that and you've placed the dam with the clamp in the mouth, excuse me, we then want to use the frame to retract the edges of the dam outward so that we have a flat and open retracted dam, not flopping in onto the operating site. Okay, so the tension will also excuse me, retract the soft tissues away from the operating site. There are different types of frames you can use. The metal frame, this one in the middle, is the most common one, and that's the one we'll be using in the simulation lab and in the clinics. There are some plastic frames as well that can be used, and they are preferred in the cases where we will be taking x-rays excuse me, of the patient's tooth while the rubber dam is in place, for example during endodontic treatment. The metal will interfere with the radiograph, so it will be superimposed on the radiograph and cause problems, whereas the plastic ones can be made of radiolucent material which allow the beams to pass through. So it just depends on the treatment you're doing on the day. The plastic frames are also lighter, but do tend to be bulkier in relation to the metal frames. And the last piece of equipment is the anterior anchor. And so if we are anchoring a rubber dam towards the front of the mouth, then rather than a clamp, we may choose to slip the rubber dam over the tooth and then just use something like these rubber widgets just to push up interdentally between the teeth and just to sit there in place to actually just wedge the dam into place. That's the equipment and the general concepts for tooth isolation, in particular the use of rubber dam.